Good afternoon, everyone, and bonjour à toutes et à tous.
Good
Today,
afternoon,
I'd like to offer some guidance to Canadians planning gatherings or events during the colder months. But first, I'll start with the latest numbers. There have been 138,010 cases of COVID-19 in Canada, including 9,179 deaths. 88% of people have now recovered. Over the past week, over 47,000 people were tested daily, with 1.5% of people testing positive. An average of 838 new cases have been reported daily during the most recent 7 days. Canadians have no doubt noticed that today's numbers have continued an upward trend in COVID-19 cases. The acceleration in cases in several regions is a cause for concern. We must all act now to pump the brakes, so to speak, on this acceleration. Multiple reported outbreaks have been linked to single gatherings, such as private social events and celebrations, and community events held indoors. The acceleration in cases has occurred at a time when the weather has turned colder and Canadians have begun to move indoors for fall and winter. With important holidays and gatherings approaching this fall, I know Canadians want to know how they can gather safely, ensure that an event remains a happy memory, days, weeks, and years later. The most important thing to know is that any gathering carries risks of transmitting the virus. With that said, there are some things that we can all do to reduce, but not eliminate the risk. The most important step hosts can take when having a gathering is to stick to their established contact bubbles. If you are thinking of hosting an event for people outside of your contacts bubble, ask yourself if you, someone in your household, or someone you are inviting are at high risk of developing complications from COVID-19. People at high risk include older adults, people of any age with compromised immune systems or chronic medical conditions such as diabetes, hypertension, lung disease, as well as people living with obesity. If the gathering would include someone at high risk, including yourself, the event may not be appropriate. The next best thing hosts can do to reduce their risk is to hold the event outdoors. We all know that colder weather is coming, but gathering outdoors while bundled up is a preferred way to reduce your risk. There are many other ways that hosts can reduce the risk for their guests indoors. For example, postpone the event if you're sick and ask guests who are sick not to attend. Ensure guests have enough space to practice physical distancing at the event, considering asking your guests to wear a mask or face covering, and provide masks for those who don't have them. Make sure guests have access to soap and water or hand sanitizer, and encourage them to wash their hands often and clean common surfaces, such as doorknobs, handles, and tabletops frequently during the event. Canadians can find these suggestions and others at canada.ca/coronavirus. Our traditional gatherings may look different this fall, but I know that hosts will feel better knowing that they did everything they could to reduce the risk of their event becoming another outbreak. Thank you.
Bonjour à toutes et à tous. Aujourd'hui, j'aimerais offrir quelques conseils aux Canadiens qui planifient des rassemblements ou des événements pendant les mois les plus froids. Mais d'abord, je commencerai par les derniers chiffres. Il y a eu 138 000 cas de COVID-19 au Canada, dont 9 179 décès. Les personnes infectées, 88% sont rétablies. Au cours de la dernière semaine, plus de 47 000 personnes ont été testées chaque jour,
tested daily, with 1.5% of people testing positive.
En moyenne,
An average of 838 new cases have been reported daily during the most recent 7 days. Canadians have no doubt noticed that today's numbers have continued an upward trend in COVID-19 cases. This acceleration in cases in several regions is cause for concern. We must all act now to pump the brakes, so to speak, on this acceleration. Several reported outbreaks have been linked to single gatherings
sociaux, privés, des célébrations et des événements communautaires organisés à l'intérieur. L'augmentation des cas s'est produite à un moment où le temps s'est refroidi et où les Canadiens ont commencé à se réfugier à l'intérieur pour l'automne et l'hiver. À l'approche des fêtes importantes et des rassemblements de cet automne, je sais que les Canadiens veulent savoir comment se rassembler en toute sécurité et s'assurer qu'un événement reste un souvenir heureux des jours, des semaines et des années plus tard. La chose la plus importante à savoir est que tout rassemblement comporte un risque de transmission du virus. Cela étant dit, il y a des choses que nous pouvons tous faire pour réduire, mais pas éliminer le risque. La mesure la plus importante
The most important step hosts can take when having a gathering is to stick to their established contacts bubble. If you are thinking of hosting an event for people outside of your contacts bubble, ask yourself if you, someone in your household, or someone you are inviting are at high risk of developing complications from COVID-19.
Les personnes à haut risque comprennent les adultes âgés, les personnes de tous les âges dont le système immunitaire est affaibli ou ayant des problèmes de santé chroniques comme le diabète, l'hypertension et les maladies pulmonaires, les personnes vivant avec l'obésité. Si le rassemblement devait inclure une personne à haut risque, dont vous-même, l'événement pourrait ne pas être approprié. La seconde meilleure chose que les autres peuvent faire pour réduire les risques est de tenir l'événement en plein air. Nous savons tous que le temps se refroidit, mais se rassembler à l'extérieur, bien ou mitouflé, est un moyen privilégié de réduire les risques. Il existe de nombreux autres moyens pour les autres de réduire les risques pour leurs invités à l'intérieur. Par exemple, reportez l'événement si vous êtes malade et demandez aux invités qui sont malades de ne pas y assister. S'assurer que les invités disposent d'un espace suffisant pour pratiquer la distanciation physique lors de l'événement. Envisagez de demander à vos invités de porter des masques ou de couvre-visage et fournissez des masques à ceux qui n'en ont pas. Veillez à ce que les invités aient accès à de l'eau et du savon ou à du désinfectant pour les mains et les encouragez à se laver souvent les mains. Nettoyez fréquemment les surfaces communes telles que les boutons de porte, les poignées et les dessus de table pendant l'événement. Les Canadiens peuvent trouver ces suggestions et d'autres encore sur le site canada.ca/le-coronavirus. Nos rassemblements traditionnels peuvent sembler différents cet automne, mais je sais que les autres se sentiront mieux en sachant qu'ils ont fait tout leur possible pour réduire le risque que leur événement se transforme en une nouvelle épidémie. Merci.
Thank you.
Thank you, doctors. We will now open the line to questions. Comme d'habitude, vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking questions in the room, we ask that you make your way to the freestanding mics. We'll start on the phone. Operator, over to you.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question is from Mia Rapson from the Canadian Press. Please go ahead.
Hi, good morning or good afternoon. I'm wondering about testing capacity. We've seen lots of stories in the last couple of days about really long lines, testing centers having to close to new arrivals because they've reached capacity. I'm wondering, Dr. Tam, how concerned you are about our ability to meet the testing demand and what work is underway to maybe expand it, and if that 60,000 capacity number you had mentioned in the spring is still what our capacity is for testing.
Thank you for the question. As we continue to work with all the provincial laboratories very closely, my understanding is that the capacity is beyond the 60,000. Now, there may be other reasons why lineups occur in different spots. Maybe the lineups don't occur in certain localities, but longer in others. So that's somewhat sort of on the ground programming or logistics. I understand that Alberta, for example, made a massive effort over the past weekend to get through some backlogs. So I think they're working really hard to try and figure this out. Some of it might be human resource, for instance. What the federal government is doing, and our National Microbiology Lab is also looking at how we can recruit other federal government laboratories to enhance that capacity as well. So that is generally right now the PCR platform, which needs, a swab at the back of your nose in general, and then sending it to a lab. There's a lot of interest, including in the public health sector, for the more easy-to-use rapid tests, which I do think, I totally agree with, a number of the comments and the experts, and that we need to augment the portfolio of testing capabilities in Canada. And so I think that's something that we need to, push hard at. And, the regulator in Health Canada has clarified that, of course, it is prepared to work hard to get us tests that are reliable and accurate as well. And so I think all of those aspects are being examined right now. And then, where in the sort of spectrum of testing approaches would we slot in these newer tests is something that is actively being discussed at the Special Advisory Committee and the Canadian Public Health Laboratory Network.
Thank you. Follow-up?
Thanks for that. I'm wondering then, as a follow-up to that, when you think some of that might be available? When are we going to see these rapid tests? When are we going to start seeing more saliva-based testing instead of just the ones that we're seeing now? Is this imminent? Are we still weeks away from this? What's the timeline on that?
So I cannot sort of predict the timelines on the regulatory side. I think we have to recognize that we can't sort of skip sort of key regulatory steps. But I know that, let's just separate the rapid testing for a second. I know that using saliva as a sample is something that has been studied in multiple places across Canada. So that's a collection method that is not the, but that collection method means the saliva samples were to be sent back to a lab for PCR testing. And so that some of that is already occurring in different parts of Canada, and we are just trying to look at those results and standardizing them as well. So I think that's actually something that people will see more. But what we're all wanting is something that is even more easy to use than that. You've probably heard about pooled sampling, trying to increase laboratory capacity, particularly in areas where there is sort of low numbers of cases where you can pull these samples. And that is also being done in some laboratories already in Canada. So you're seeing a number of these newer approaches, I think, coming up. So that's and obviously we'll try and give updates as we get more information.
Thank you, Doctor. Operator, next question.
Thank you. Merci. La prochaine question est de Hélène Buzetti.
The next question from Hélène Buzetti, Le
Yes,
Devoir.
Dr. Tam, my question is for you. I would like you to clarify what a person is supposed to do after being in contact with a person who's positive to COVID. Does that person need to isolate for 14 days, or can that person remain in isolation for a shorter period of time if they get a negative result?
So, if you are essentially a contact and has been verified, or you should be checking in with your local public health unit, because there's different kinds of exposure. You could be a contact as part of an outbreak, for instance, or other types of contact. So you should follow public health advice. So what in general in Canada, the guidance is that the period of quarantine for contact should be 14 days. And so that is the current approach right now. And so, we generally will continue to actively pursue any changes in policy as we discuss it more with the provinces, but that's where it stands. Contacts may be tested, obviously, if they get symptomatic. But if you're tested as part of an outbreak, say if you're in a long-term care facility and you're a contact and you are tested negative, that doesn't necessarily mean that you will get out of that quarantine period. People are being very cautious and, in general, keeping their contacts in that 14-day quarantine period.
I'm asking the question. I'm asking specifically the question because the Bloc Quebecois MPs have been in contact with a close person who is positive. So the question is, should they remain in isolation for 14 days, or if they get a negative result in the next few days, can they get out and then come back to Parliament, for instance?
I don't know that specific circumstance, but right now the quarantine period is 14 days. So unless there's maybe serial testing, the one negative test does not guarantee that you don't have the virus. It's only a test one point in time. But these are not sort of regular testing protocols right now in Canada, but are things that are being explored as options going forwards. But it means that someone has to have repeat testing.
Merci, Doctor. Operator, next question.
Merci. Thank you. Our next question is from Tessie Sanchi from Hill Times Research. Please go ahead.
Hi, thanks for taking my question. I'd like to ask about communication strategies, especially in light of the rising numbers and the fact that our circumstances are very different from the spring when, it was harder to go into a business because all the businesses were closed. Is there going to be a shift at PHAC in terms of how you connect with different demographics in terms of the rising numbers and the fact that we are able to go to school and work?
That's a really important question. I think in the, we've learned a lot about this virus, but we still don't have a vaccine. The treatments are still, there's some improvements in treatments and we're learning more about that. But then, what the public does and public behavior becomes such a central part of what will lead to success in terms of controlling the epidemic itself. So absolutely, I think reaching that new demographic of 29-year-old to 39-year-old is really important. I think from the Public Health Agency and the broader Government of Canada perspective, we are trying to sort of push new kinds of engagement and advertising, I think testimonials, but advertising that appeals more based on behavioral insight to the messages that younger generations may need to may pay more attention to. Influences in social media space that is, not us because they don't listen to us, in the, older public health leadership. So that all of that is being pursued, partnering with social media platforms to see what they can do to help, lifting up, key messages as people search for that aspect, but also, gaming companies, any number of those ideas we are looking at. But the other thing that you said was very important is that we need to engage private sectors, I think, even more. Businesses will have ideas about how to message to their clientele, for instance. Working with educational institutions, it could be colleges, universities, but certainly workplaces as well. So I think it should be sort of all hands on deck in terms of trying to message to different populations, which are quite different from what we saw in the initial wave.
Thank you. Follow-up?
So in terms of my follow-up, related to communication, so public health officers across the country are often asked, what's the magic number in terms of shutting down again? And nobody ever provides a number because they all say that's not how public health works. So how do you get people to understand, when we'll have to go back to the measures of the winter and spring, which I think a lot of people would say we don't want to do. How do you get people to understand when that is if we don't know what those levels are, if we don't know what we have to stay away from?
Well, yeah, and I think I will probably not provide you with an answer that's that different to what my colleagues would have said, but you've seen that different jurisdictions are trying to sort of message using different alert levels, for example. We are looking at a more granular level in terms of the community levels of cases per 100,000, for instance, so that alerts can be sent out ahead of potential need to increase more restrictive measures. But, it all depends on the data right now where people are trying to be really targeted so that if they are seeing certain settings or certain sectors, whether they be nightclubs or other settings where they are getting outbreaks, that's where they will be much more targeted in terms of their restrictions instead of more blanket approaches to the whole community. I think that is where we are sort of working with right now. But I also have to say that, if you're going to, do some of these public health measures, you do have to do it relatively early. You can't sort of wait around until, you get into an exponential growth in your cases. So we're monitoring the acceleration, I think, across the country in not just the numbers, but how fast and rapidly they go up, and take into account all of those parameters. We're trying to sort of have as localized an approach as possible, I think, is how we're trying to keep this wave from accelerating. What you're seeing now, of course, is concerning, and just to remind people that it is what actually happened in the last couple of weeks that resulted in the increase in cases that we're seeing. So we are always looking backwards as opposed to, projecting forwards. So, the key message is that the time to act is now, like across the board, in terms of, reducing some of those contacts that you may have had over the summer months. So to everybody looking at what they've been doing in the last couple of weeks and the last month and try and see how they can actually help with reducing risk of transmission.
Yeah, it's Dr. Njoo. Maybe I can just add a few additional comments to what Dr. Tam said. So first of all, with respect to the messaging, we've got a lot of communication expertise within the agency and across government. And I think we're doing a bit of what we call almost like a social marketing approach, recognizing it's not one size fits all. The communication approach needs to look at, we call segmenting the market, looking at the specific demographics and at-risk groups. As has been pointed out, certainly young adults are at increased risks. We've been doing things like focus group testing, listening to, obviously, the different demographic groups, what their concerns, issues are. And we've tailored our approach. And we recognize also that in terms of messaging out, we can't just rely on a single platform, being it, for example, press conferences. We need to use various social media platforms, gaming platforms, depending on where various demographic groups obviously get their information and so on. So that's one part. With respect to the sort of the targets and so on, as Dr. Tam has said, I don't think we can rely on and focus too much on a single metric or target. I think there are lots of different metrics that the public health authorities are looking at in terms of what's happening at a regional level. It could be a sort of case counts, or looking at trends, the proportion of cases in different demographic groups. You could look at lab positivity rates and so on and so forth. I think at the end of the day, there's only so much governments can do. We can certainly put out the same messages we've been doing for so long. Obviously, the good public health measures in terms of good hand hygiene, respiratory etiquette, social distancing, wearing face coverings or masks. But at the end of the day, it really comes down to personal responsibility. Everyone has to recognize that we all have a part to play, and that by whatever measures or whatever behaviors you actually do today, the consequences will actually sometimes manifest themselves, or a week or so later. So I think rather than people focusing, let's look at the data and figure, are we close to that target? Maybe I'll change my behavior then. No, I think the time is now. You need to change your behavior now so we can avoid getting to those figures that we don't want to get to. Thank you.
Thank you, doctors. We will now turn over to the room. First question in the room, CTV.
Hi, it's Annie Bergeron-Oliver with CTV National News. Earlier this month, your department said that it was willing to look into home tests, and that's something that the U.S. is doing currently. I'm just wondering where the government is at in this process and why these home testing kits weren't looked at more seriously before in preparation for a second wave.
I think, as I just said at the beginning, we're open to all kinds of innovation, and the government has invested in different testing platforms throughout, right from the beginning. And some of those investments are still, coming up in terms of being going through regulatory. They have to go through regulatory processes because I don't know if you recall, there were some tests, for example, in the United States that in the end didn't really perform, and then you get into some issues with how you interpret those tests. So I think people are just trying to be careful. At the same time, I think some of these modalities are beginning to come up to sort of reality. So right now, I think is the time to really accelerate the getting Canadians those capacity. But what the other thing is that however these tests are performed, we have to be very clear as to what actions come as a result of the test. And so some of it will be making sure the public health system is ready to link with people who, for example, detect a positive, so that actual public health action can be performed. So it may mean more testing if someone came up to be positive. So all those pieces have to be at play. But I think, we all agree that we have to just keep at it in terms of acquisition. You've seen how we've managed to look at vaccines, for example. So the same kind of push, as it were, to get access to testing is something that, I think the whole public health system is seized with right now.
Yeah, it's Dr. Maybe can you just add to what Dr. Tam said? I think maybe it's a misconception that we weren't looking at home tests or other types of testing modalities. I think there's been a lot of work, as I say, behind the scenes. We're always looking at different types of testing technologies, and one of the key things is that whenever a new potential promising test technology becomes available, or at least comes to our attention, there's a lot of work to validate and see how well it performs compared to what we now know is still the current gold standard, being the PCR test. And so as we move forward, there's a whole regulatory process that Dr. Tam mentioned that needs to be obviously respected. But as well, for all these new tests and these potential new, tools in the toolbox, we also need to know the right way to use them in the right context. Because, for example, if the PCR test is still a gold standard, you want to make sure that you're using that in its best possible advantage, for cases where you really need to be very, very, very sort of clear that you get an accurate result. For other types of testing technologies, it may well be that they don't perform as well as PCR, but that doesn't mean they should be discounted. Maybe the sensitivity or some other attribute is not to the same standard as a PCR, but maybe in other contexts, for example, testing populations or asymptomatic on a regular basis, potentially in the workplace. That might be the kind of situation in which other types of testing modalities could be used. So that's all the kind of work that's going on behind the scenes. And as they become available and, to be used, in the, let's say, the general population, one of the other things that all of our experts are also working on is actually developing guidance so that public health authorities, laboratory specialists, and clinicians know exactly what kind of tests could or should be used in the best available way, depending on the context. Thank you.
This next question is for both of you. A number of U.S. public health officials, especially women, have recently raised concerns about the personal and professional threats that have been leveled against them simply because of the fact that they're a public health official. Now, one Australian health official says she's under police guard because of the threats against her. So I'm wondering if either of you have ever faced any threats, and why do you think that public health officials across the world seem to be becoming targets?
Well, I think, it is actually a really tough job being chief medical officers, and I think I can say that for our colleagues as well. There's always going to be some people who are not happy with what you're doing, and and that's to be expected, I think. So I think, from my perspective, I, think that right now it's just part of my job. I'm being supported in terms of the work that I'm doing. So I don't really have anything more to add, actually.
Yeah, I think for myself personally, I think for Dr. Tam, myself, and public health officials throughout Canada and around the world, I think we really have sort of the best interests of our populations at heart, for ourselves, safeguarding the health and safety of Canadians is paramount. It's a priority. And even as a physician and a clinician, I would say that, yes, our whole training is based on doing what's best for the patient. In this case, at a population level, it's slightly different, but the same, I think, motivation is there. And so I think we're always guided by the science. We're always guided by the evidence as it continues to evolve. We continue to work very collaboratively with our colleagues around the world because we all have so much to learn from each other. Things that are happening in different countries, different experiences, be it in schools or other settings, I think are certainly things that we can build on, because I think no single country or entity or organization is going to be able to sort of solve it all on their own. And I think global collaboration is the key to dealing with this pandemic and ultimately successfully, hopefully, putting an end to it.
Thank you, doctors. Next question. I'm doing one back for your press.
Hi, Dr. Tam. A bit of a vague question and a more precise follow-up. There's a bit of a tension between privacy and the public right to know in public health, and I'm wondering, what are the principles that should guide that balance in public health communication?
Yeah, I mean, that's certainly a very broad question, and it's not just a matter of communication. It governs what we do every day. So, even data sharing is one of the key areas, right, where from the local and provincial jurisdictions and the federal government, there's very strict rules about privacy and how we report data and statistics. So even is when numbers are small, you have to be really careful about identifying individuals, etc. So that is just a regular part of public health information sharing. There's also sometimes, when you're talking about security or stigma or discrimination, you also have to be really careful about how you communicate that data, because people could be inadvertently, their safety could be compromised, for example. There's many different dimensions, but on the whole, data is presented generally, at least when we do it at the national level, is a fairly sort of aggregate types of information, and we try not to be divulging individual kind of information in the public domain.
Yeah, it's Dr. Njoo. I just would add an additional point to what Dr. Tam said. It's interesting. People may not know that, confidentiality and safeguarding, people's sort of private information has always been paramount in terms of how public health deals with data at a population level. For example, if we get data on a specific disease, we're always careful if, let's say, the data we get from a certain reporting region is, really involves small numbers, where it's possible based on age group and other identifying data that you could actually, even figure out who that individual might be. What I think is happening now, and I think it's something that we're well aware of, is that there's such a thirst, I think, in maybe the general population for open, transparent communication that people want to know about every single case of COVID-19. And I think there's a risk there because, an individual case, for example, if it occurs in the school, to what end does that need to be made public, as opposed to having the information there for public health purposes and the right people having access to it so they can do their job, as opposed to people just want to know for what purpose? And that, I think, is something that people should be aware of, that not necessarily every single case in every single setting should be made public, because if it doesn't really serve anything in terms of public health purposes, then really you are starting to infringe on people's individual privacy.
My follow-up is on that note, when there's an outbreak that's constrained to one community or one business or a school, does it not make sense to name these places so that people know when they have to increase their vigilance?
So, at the national level, we generally don't get into that level of details. But yes, if the public health unit feels that there's public health action as a result of the sharing of that information, they will do so. So if the sharing of, a certain setting leads to very specific public health action and there's a basis for doing that, then they will act accordingly.
Thank you, doctors. We'll take the next question in the room. CBC.
Tom Perry from CBC. My first question is actually on a different topic. Public Health has issued a warning about salmonella in onions imported from the United States. I'd just like to know what your advice is to consumers, how big a risk this is, and I guess what kind of work you're doing with the food inspection to try and mitigate this risk.
Yes, so the outbreak you're talking about has actually been going on for some time, and a number of what we call public health notices have gone out to Canadians, so definitely check out the website. And it is actually to do with onions that are from the United States, so the information is there. So the general advice being that if you don't know where your onions came from, you should discard them. Always do good, practices in terms of cooking and hygienic practices. But the recall of the specific affected onions, as I recall, has been done by the companies that are distributing this to the United States, but also to Canada. And the CFIA's role, we work very closely with them, and also with Health Canada, who assesses the risk related to the food product. And CFIA is the one linking with the industry from the sort of recall perspective on the product itself. And our job has been to provide information about the Canadians being affected and the outbreak investigation. So you see all three organizations in the health portfolio picking up its role and communicating both the product recalls and the human cases with Canadians. And certainly with salmonella, there are also people with risk factors and as well that has to be careful about it. But yeah, if you don't know where your onions are coming from, you can't sort of go to the website and look at if it's the affected batches. But if it's not and you don't know where it comes from, then throw it away.
On the subject of testing, we've seen in Ottawa and in Toronto a lot of parents lining up with their kids to get their kids tested. And I'm wondering if you're worried that the kind of delays that we're seeing, if it's making it harder for these kids to get back to school safely, for schools to remain open safely. And again, is there anything more that the government can do to try and, take on this backlog?
Yeah, so I think I covered some of that, and it depends on where you are in the country, and we're certainly there to try and support the provinces. A massive investment from the federal government in terms of sort of financial support, but getting the reagents, making sure there are swabs, and all of these things is what we're doing. At the same time as we will offer some surge capacity to local and provincial departments if they need the surge support of federal laboratories as sort of a rapid surge response. But continuing to try and access new testing, which is what we've talked about already. But of course, we don't have specifics on exactly where the bottlenecks are. So I think in the whole sort of critical path of someone needing a test to getting the results, there may be different challenges along the way. So if the challenge is a human resource one, that's a different answer to one which is about logistics or something. But it is true, there is a very important indicator of the public health capacity and how we can manage this outbreak, because if you don't know your lab tests and the lab testing turnaround is long, then that might be why we're going to get transmission. So, and seeing the numbers rise. So, everything that we have to do has to be trying to reduce that turnaround time. we did talk a little bit about prioritization of testing as well, so that if you're the worried well and you're lining up at the same time as the people who actually have symptoms and may contact who may have been exposed, the system needs to be able to do that prioritization as well. So that's something that I know the provinces are seized with, like prioritizing the samples, where you really need to know the answer as fast as possible. And then maybe there is a bunch of people who is not sure, or, you know, we have to make sure our system function efficiently, really.
Thank you. We will now turn back to the phone. Operator, prochaine question.
Thank you. Merci. As a reminder, please press star 1 at this time if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. Notre prochaine question est de Catherine Lévesque de la Presse canadienne. À vous la parole.
Catherine Lévesque from Canadian Press. You have the floor.
Oui, bonjour, Dr. Tam, Dr.
Good afternoon,
Njoo.
Dr. Tam and Dr.
Je voulais vous
Njoo.
entendre en
I
français
would like to
sur
hear
une question
you
de
in
ma
French
collègue
on a
Hélène
question from my
Buzetti,
colleague Hélène
parce
Buzetti,
qu'effectivement, il semble y avoir
because there
un
seems
peu de
to
confusion
be a bit
sur
of
les critères de
confusion
quarantaine.
about the
Alors,
quarantine
je
criteria.
vous le redemande, en fait,
So I would
si on
like
a
to
été en
ask you,
contact avec
if
une
we're in
personne
contact
infectée
with
par
an
la
infected
COVID, est-ce qu'il
individual
faut
with
s'isoler
COVID,
pendant
what
2
do we
semaines,
need to
donc
isolate for
14
2
jours, même
weeks,
si on a
14
eu un
days,
résultat
even if we
négatif?
had a negative result?
Peut-être moi, je vais commencer. Merci
I
pour
will
la question,
start.
c'est
Thank you
Dr.
for the
Njoo. Oui,
question. This is Dr. Njoo.
c'est difficile. En fin de compte, je pense
Yes,
que
at the end of the
Dr. Tam a
day,
déjà
I think that
constaté,
Dr.
c'est la
Tam
chose la plus
already said
importante,
that
c'est
the most
vraiment
important
suivre les
thing is really
conseils,
to
les
follow
consignes
the advice and
des
directives
autorités de
of
santé publique à
local
l'échelle
public health
locale. Donc,
authorities.
si, par exemple,
for example,
vous êtes ici à
if you
Ottawa
are
et
here
vous
in
envoyez
Ottawa
vos enfants ici aux
you
écoles
send
à
your
Ottawa,
children to school
si
in
quelque chose
Ottawa,
arrive, c'est
if
important de
something happens,
suivre
it's important
ce que
to
Dr.
follow
Verachis,
what
médecin
Dr.
hygiéniste en chef
Verachis
d'Ottawa,
says.
qu'est-ce qu'elle dit. Mais en général,
But in
on sait
general,
que la période
we know
d'incubation,
that
c'est
the incubation
jusqu'à,
period is up
les limites,
to
c'est jusqu'à 14
14
jours.
days. That is the limit.
Donc, si
So,
un enfant, en
if a
général,
child, in
peut-être
general,
est identifié comme un contact, un
identified
cas
as a
confirmé,
contact
et
of a
il faut
confirmed
peut-être
case,
faire un suivi.
they must
C'est
conduct a
vraiment
follow-up.
selon comme
It's really
le protocole de la ville d'Ottawa, il faut suivre. Je pense en général, je pense que ce que je comprends, mais peut-être que j'ai tort, que l'enfant peut-être doit aller peut-être pour un test de dépistage pour la COVID-19. Mais comme Dr. Tam et moi et tous les autorités, les experts ont déjà constaté qu'un test à un moment donné peut être négatif, une fausse négative, parce que si vraiment on s'est exposé à la COVID-19, et c'est sûrement peut-être 1-2 jours après, c'est toujours possible d'avoir un résultat négatif. Donc, je pense que si l'enfant est allé pour un dépistage et a reçu puis après un résultat négatif, ça ne veut dire pas que c'est sûr que l'enfant n'a pas la COVID-19. Je pense qu'il faut suivre exactement ce que les autorités ou le département de santé publique d'Ottawa dit. Je pense que c'est aussi une question peut-être surveiller pour les symptômes, peut-être un petit protocole, quand peut-être on peut retourner à l'école. Donc, je pense que c'est difficile comme à l'échelle nationale de dire exactement qu'est-ce qu'il doit faire dans toutes les situations à l'échelle locale.
Individuals must do in all local circumstances. Thank you. Next question.
Oui.
Question suivie?
A follow-up question, rather.
Catherine?
Oui, allô, on m'entend?
Oui,
yes, do you hear me?
Allez-y avec votre question
yes,
suivie.
please go ahead with your follow-up question.
Oui, c'est ça.
Yes.
Alors, je comprends votre point, M.
I understand
Njoo.
your
Je comprends qu'il faut respecter les consignes locales, mais en même temps, la consigne générale, j'aimerais juste savoir, comme administrateur de la santé publique, qu'est-ce que vous dites, que ce soit un enfant, que ce soit un adulte qui a été en contact avec une personne confirmée par la COVID-19, est-ce que cette personne doit s'isoler, peu importe ce qui arrive, même si elle a eu un test négatif, est-ce qu'elle doit passer un deuxième test ou peu importe ce qui arrive, il faut qu'elle reste, que cette personne reste isolée pendant 2 semaines.
For 14 days, rather.
C'est Dr. Njoo encore. Je pense que c'est vraiment quelque chose il faut suivre. C'est quoi les la direction à l'échelle locale. Je pense au début, c'est sûr que la science continue à évoluer. Je pense au début, avec les sciences, on pensait avant que c'est seulement les personnes asymptomatiques qui posent un risque aux autres pour la transmission de la COVID-19. Et donc, si vous avez passé comme une semaine après l'exposition, ce n'est pas un problème. Ce ne serait pas un problème. Mais je pense maintenant, c'est toujours aussi une question de gestion de risque à l'échelle locale. Il faut vraiment regarder c'est quoi la situation épidémiologique dans une région et suivre qu'est-ce que les autorités disent. Je pense que pour un enfant, en général, on sait aussi que avec la période d'incubation, si on s'est exposé à la COVID-19, la plupart, mais c'est juste la plupart, mais peut-être pas 100% des personnes vont avoir des symptômes à peu près une semaine après l'exposition. Donc, c'est quelque chose que les autorités de santé publique à l'échelle locale aussi, tout le monde connaît la même science. Et c'est vraiment une question pour eux. Pour trouver l'équilibre, s'il y a un enfant qui peut-être a eu un contact, peut-être est déjà allé pour un test, un dépistage, c'est quoi la direction pour le retour à l'école? En sachant c'est quoi la science et vraiment que la limite extrême, c'est 14 jours, mais la plupart, c'est peut-être une semaine. Mais ce n'est pas vraiment pour moi pour dire aux autorités à l'échelle locale, c'est quoi la politique qu'il faut implanter à l'échelle locale.
Parfait, opérateur. On a le temps pour une dernière question, s'il vous plaît.
Merci. Thank you. Our next question is from Katie Dangerfield from Global News. Please go ahead.
Hi, thanks for taking my question. Going back to the testing question, as we see increased demands for tests across the country, what do you want Canadians to keep in mind as they decide whether or not they should get tested or not?
So, obviously, it depends on where you are in the country, but the key priority for testing is if you have symptoms, and they can be mild because, as we all know, that COVID-19 can have a range of symptoms, and often they are quite mild. So those are the people that should get tested as a recommendation. For people who have no symptoms, in general, those are the contacts of cases or you're part of an outbreak. That's how we would recommend. You think you've been exposed or you had your COVID alert app and someone says, oh, you've been next to someone who might, who is a case. So those are the key people. You're a potential contact. You have an exposure risk. You should then, obviously phone your health line, but to figure out how to get tested. But that's the next tranche. What we are examining, and some provinces have been doing, is more sort of screening of high-risk places, such as long-term care and maybe certain workplaces. Some of them are like remote workplaces up in the north where you can't afford to have an introduction of a person with COVID-19. So they've been taking extra measures to check people as they arrive and do some of that screening. Ontario has been testing, for example, people who work in long-term care. And so that is a different application of the test, and that should be instructed by your local public health as well. So now we're discussing, if beyond the PCR testing platform, which is what we have now, what is the appropriate application of rapid tests? Some of them are these antigen tests. You may be able to do that yourself, and where that fits in with the testing landscape. But right now is mild symptoms, contacts, or any kind of exposure. Those are the top sort of reasons for lining up for that test.
Thank you. Follow-up question?
No, that's great. Thank you.
C'est ce qui m'a fait la conférence de presse pour aujourd'hui. That will be all for today's press conference. Thank you.
Thank you. Merci. The conference has now ended. Please disconnect your lines at this time, and we thank you for your participation. La conférence est maintenant terminée. Et s'il vous plaît, raccrochez votre ligne. Et merci à tous les participants qui se sont joints.